Good day everyone, I am Nurse Hannah and we have our client here, and today we're gonna assess her eyes, ears, nose and paranasal sinuses, mouth and throat. It is necessary to do this procedure because we can see if there's any abnormalities. Before I proceed, I make sure that I wash my hands and sanitize it very careful. And now we're gonna provide some privacy to our client. Hi ma'am, I am Hannah and everything that we will be discussed will remain confidential, and the information that we're going to provide will remain to our healthcare provider. And now we're gonna assess the equipment. Sterile gloves, face mask, tongue depressor, gauze pad, and cotton applicator, pen light, and we have here the Snellen chart. Later, I'm going to show it to all of you. So, let's proceed now to asking her some of her client's history. So I observe that you are wearing a correction eyeglass. Do you have a problem in reading in far or in near?
Far.
So our client is nearsighted and she have a problem in reading things in far. Do you have family history of diabetes?
No.
Do you have a surgery, eye surgery, injury?
No.
When is your last visit of ophthalmologist?
Last September.
And do you use current medication, eye medication?
No.
So our client here doesn't feel any eye disease, and she visited the ophthalmologist last September 2019. So we're gonna inspect her external eye structure. Can you please remove your eyeglass for a bit? I'm gonna inspect her eyebrows, the hair distribution of her eyebrows. So her eyebrows is symmetrical and the hair distribution is perfectly normal. Can you please raise your eyebrows? Do you have any pain doing that?
No.
So the client can freely move her eyebrows and she doesn't feel any pain. And I'm gonna inspect her eyelashes. Can you please blink? Her eyelashes is perfectly distributed to both of her eyes and she can blink freely. Do you feel any pain while blinking?
No.
Now I'm gonna inspect her bulbar conjunctiva for color, texture, and the presence of any lesions. I'm gonna touch your face, ma'am. Is it alright?
Yes.
Can you please look up? So her bulbar conjunctiva is perfectly normal. There's no sign or presence of lesions or any abnormal redness, and her capillaries is visible. So it's perfectly normal. And next, we're gonna inspect her palpebral conjunctiva. And before that, we're gonna use a cotton applicator. Can you please, I will touch your eyelash. Her palpebral conjunctiva is clear, moist, and smooth. There's no presence of any lesions and her sclera is white. And now I'm gonna inspect and palpate her lacrimal gland. Do you feel any pain?
No.
Okay, so the client doesn't feel any pain. There's no swelling or redness. And next is we're gonna palpate her the lacrimal sac and nasolacrimal duct. Do you feel any pain, ma'am?
No.
There's no drainage and it is perfectly normal. So, we're done assessing her external eye, and after as far as I can observe, it is perfectly normal. Now we're gonna inspect and assess her internal eye structure. I'm gonna inspect the cornea. Can you please look straight? I will use a pen light and move the light across the corneal structure. It is transparent, shiny, and it appears over the it is transparent, shiny, and smooth. So, the iris are visible too. So, it is perfectly normal. And I'm gonna perform the corneal sensitivity reflex test. I'm gonna use here a gauze pad to inspect the reflex of her cornea. We're gonna determine if the trigeminal cranial nerve or the fifth cranial nerve is functioning. So here I'm gonna put my gauze pad, the angle of the gauze pad in the corner of her cornea. So after assessing her cornea, her fifth trigeminal cranial nerve is half reflex and it is functioning. So it is perfectly normal. So I'm gonna inspect her pupils, the color and the shape, and the symmetry of the eyes. So her pupils are black and it has a normal size, 3 to 7 millimeter in diameter. It is round and smooth. Now we're gonna proceed to visual acuity. So the client is using eyeglasses, so she will use it, and we're gonna let her read some magazine into 14 inches away from her in near vision.
We offer the best quality.
So she can read in her right eye.
We offer the best quality.
So after that, she has a normal near visual acuity, and so that means she can read what a normal person can read at 14 inches away. Now we're gonna proceed at the normal distance acuity, visual acuity. And I'm gonna show you the Snellen chart.
FELOPZD DEFPOTEC
How about the other side, ma'am?
FELOPZDDEFPOTEC.
So, after assessing her distance vision, she can read up to 20/20. So, using her correction eyeglass, she can read what a normal person can read at 20 feet away. Now, we're gonna assess her ears. Ma'am, do you have a family member who has a hearing problem?
No.
Do you experience any ear problems?
No.
Do you take any medication?
No.
Any hearing difficulty?
No.
So the client doesn't feel any difficulty in hearing. So you're gonna sit comfortably to help you participate better. Can you please I'm gonna inspect the auricles for both of her ears and the color and the symmetry. So the auricles of her ears is symmetrical, and the size is in normal and in line with her eyes. So the auricle is fine, is normal. So I'm gonna palpate the auricles for texture and elasticity. Do you feel any pain, ma'am?
No.
So her ears doesn't have any lesions and there's no tenderness. Using my otoscope again, I'm gonna inspect the external ear canal. So there's no presence of lesions, any redness, swelling, and there's no blood. So it is perfectly normal. I'm gonna inspect the tympanic membrane for color and gloss. Her tympanic membrane is shiny and glossy and translucent with no bulging or retraction. So her ears is perfectly normal. I'm gonna assess the nose and sinuses. Ma'am, do you have any allergies regarding to your nose?
No.
Difficulty of breathing through the nose?
No.
Sinus infection injuries?
No.
Do you have frequently nose bleeding, or do you recently have nose bleeding?
No.
Do you take any medication?
No.
So I'm gonna inspect the external nose for any deviation in shapes. Her nose is symmetric and it is normal. I'm gonna palpate her nose. Can you please remove your eyeglass? I'm gonna palpate her nose to see if there's tenderness. Do you feel any pain?
No.
So there's no pain, no tenderness, and no lesions. Can you please close your mouth and breathe through the other side of your nose? Can you breathe freely?
Yes.
How about the other side? Can you breathe?
Yes.
So the client can breathe freely on both sides of her nariz. Next is we're gonna inspect the nasal cavities using a flashlight, using a pen light. So her nasal cavity is normal, and the nasal septum, inferior and medial turbinates of the nasal passages. There's no redness or swelling on her nasal cavities. There's no abnormal presence of lesions or any bumps. So her nasal cavities is normal. I'm gonna palpate the maxillary and the frontal sinuses for tenderness. Do you feel any pain?
No.
So in her frontal sinus, there's no pain, no tenderness, and no swelling. In her maxillary sinus, do you feel any pain?
No.
So there's no pain, no tenderness, and there's no bumps. So it is perfectly normal. Now I'm gonna assess the mouth and oropharynx. Do you have a dental routine pattern of dental care?
Yes.
When is your last visit of to dentist?
Last year.
Last year. Okay. So do you have any medication?
No.
Okay. So she doesn't have any medication regarding his mouth. So the client is sitting properly. I'm gonna inspect the outer lips for symmetry and the color. Can you please move your lips like pouting? So her mouth is symmetrical and the color is pale pink to pink. So it is normal. I'm gonna palpate the inner lips and buccal mucosa for color and moistures. Her inner lip is normal and it is in pink color. And it is smooth and perfectly normal. I'm gonna inspect the teeth and gums using the tongue depressor. Can you please open your mouth? So her teeth is perfect and she doesn't have any black teeth and there's no cavities. So it is normal. I'm gonna inspect the surface of the tongue for position, color, and texture. Can you please pull out your So her tongue is pink and there's a rough texture. So it is perfectly normal. I'm gonna inspect the tongue movement. Can you please move side to side? Up and down. Do you feel any pain? She can freely move her tongue and she doesn't feel any pain. I'm gonna inspect the base of her tongue, the floor of the tongue for any nodules, lumps, or excoriated areas. I'm gonna use some piece of gauze pad to assess it. Can you please pull? So her tongue is smooth and there's a prominent veins in the base of her tongue, so it's normal. Her tongue have a rough texture, so and there's no presence of any lesions or bumps. I'm gonna inspect her salivary duct opening. Can you please? So her salivary duct opening is normal and there's no lesions. I'm gonna inspect the hard and soft palate of her color, shape, texture, and the presence of bony prominences. I'm gonna use a tongue depressor again to her tongue. And I'm gonna use a pen light. Her soft palette is smooth and in light pink. So it is normal. I'm gonna inspect her ovula. Can you please say ah?
Ah.
So her ovula is normal because when she say it goes up. So last is we're gonna inspect the oropharynx for color and texture. We're gonna use a tongue blade against the tongue at the same side about halfway. So the posterior wall is pink and smooth. So everything is normal and there's no presence of any abnormalities. And we're done assessing her eyes, ears, nose, and paranasal sinuses, mouth, and throat. Thank you, and that's all.